Welcome back to our video series where we're discussing frequently asked questions about ASAP and Clarity-intensive adolescent substance abuse and mental health programming. If these or any of our other videos bring up any questions, visit our website or give us a call. Question 1. I know my teen needs help, but how can I get them to participate? By the time teens arrive for an intake assessment, their life has often become entangled in a number of problem behaviors, including substance use, toxic relationships, self-harm, risky sexual behaviors, or disordered eating. Although it may seem illogical, letting go of these behaviors can be painful and difficult for teens. Recognizing that behavioral change is a challenge is important. Additionally, it underscores the need for professional help. If these behaviors were not a problem, as teens often claim, they would have likely stopped them long before a parent seeks services. People are not likely to change their behavior without experiencing negative consequences. For example, teens coming to ASAP and Clarity may have recently gotten in trouble at school, been hospitalized, experienced turmoil at home, or had legal troubles. These events can be a catalyst to help motivate teens, but they're not usually sufficient for change without additional intervention. Collaborating with ASAP and Clarity professionals can help you to plan for your teen's pushback as we work to help guide them through the change process. It is also important to note that adolescents are unequipped to make independent decisions about their health. This is why parents play such a critical role in getting teens help. ASAP and Clarity professionals are trained to guide parents before, during, and after our intake assessments to help motivate teens to engage in the treatment process. Question 2. Intensive treatment sounds excessive. Are you sure that my teen's problem is that severe? ASAP and Clarity's flagship programs are based on an intensive outpatient model. The structure for the programs are based on established guidelines, including type of intervention and duration of session. Although the name intensive outpatient may seem extreme, on the continuum of treatment options, it actually represents a moderate level of intervention, falling between once-weekly therapy sessions and residential or hospital services. The ASAP Clarity intake assessment involves interviews with teens and parents, psychological screens, and sometimes urine drug screens before making recommendations. As mentioned, these recommendations are provided in accordance with the criteria established by the American Society of Addiction Medicine, helping to match teens with the most effective level of care. Finally, parents are often unaware of the extent and the severity of their teen's behavior, as well as the consequences it may have in the long term. ASAP Clarity staff members have years of experience working with teens. If you have questions about the results from your assessment, we're happy to consult and provide more context for the provided recommendations. Question 3. How do I help my co-parent agree on seeking treatment? It is not uncommon for parents to perceive their teen's behavior differently. Sometimes, parents will also disagree about the best course of action as they become aware of these problems, asking themselves, should we reach out and get help? Or maybe we're blowing this out of proportion. To help address these concerns, ASAP Clarity encourages all primary caregivers to attend intake assessments. During the process, clinicians meet with parents and/or guardians to explore their concerns together. Typically, this meeting helps parents understand the ways in which their teen's behavior is representative of significant risk. Additionally, research demonstrates that a united parental stance is critical in fostering change in treatment. But ultimately, parents must collaborate to determine whether they wish to follow through with treatment recommendations and guidance provided during ASAP and Clarity programming. For more information on how to get your family on the road to recovery, please give us a call or visit us on the web at asapcincinnati.com or claritybh.com.